Late. Okay. Good afternoon, everyone. Good afternoon, everyone, and welcome to this virtual session, the Pick and Speak competition. Um, Deepak, if you can hear us, if you can just let us know if you can hear us,
Yes,
Deepak.
I can hear everybody. Yes.
So much. And it's already 3:05, so we'll quickly kickstart the program. And I have Mr. Deepak Sharma, the co-founder and CEO of Medlearn, with us. And I request him to officially declare this event open and speak a few words.
All
Over
right.
to you, Deepak.
It's a great pleasure again. International Nursing Day week celebration, and I think the theme's very well picked. The impact of investing in nursing and the nursing workforce to have a wider economic impact. We seldom realize, you know, how overall, not just for the healthcare, for the hospital system or the economic well-being of the hospitals, so overall national health. I think I'm looking forward to some of the themes and the topics and the very enthusiastic participants who've put up their hands up and who've been nominated to point of view of on these topics. But you know, as far as Medland's concerned, from inception, as you know, we are in 350 hospitals. We train 125,000 hospital employees in India, and a large majority of them are nurses, and nurses make up the backbone of the of individual hospitals and the healthcare ecosystem as such. The delivery of healthcare, targeted, compassionate, uh, you know, well-managed healthcare depends entirely on the nursing community. And in the past, I think it's only been slowly realizing, even despite COVID, that the need to invest both in the uh, professional growth, psychological, mental uh, well-being of our nursing stalwarts, uh, not just in the times of crisis, but at the time of growth as well, is so important. The loss of not just lives, of productive days of lives, it happens due to poorly administered healthcare, which happens due to nursing shortages, etc. Is well, look, I'm just wait, I will not get ahead of myself and talk about this, but I think it's a very apt theme. It's a very apt theme for International Nursing Day this year. And I'm also very grateful to all the esteemed judges who volunteered to give their time and guidance and nurture to the younger participants who've stepped forward. I'm wishing everybody all the best. Looking forward to a amazing round of thought-provoking sessions and thoughtful inputs from all the senior members present here. Thank you, Mary, for organizing this. Very timely, very well needed.
Thank you so much, Deepak. So, thank you, Deepak. And we'll next move with a quick introduction of our esteemed judges for today's competition. So, I extend a very warm welcome to Mrs. Eugene P. Alexander. Madam is the nursing superintendent at St. John's Medical College Hospital, Bangalore. And she holds an MSc in nursing from Manipal College of Nursing and brings with her 30 years of experience in healthcare across India and abroad. She's a certified professional for quality implementation in hospitals, that is CPQIH, and also she is also an NABH assessor since 2023 and a life member of CAHO. Currently, she serves as a nursing superintendent at St. John's Medical College Hospital, Bangalore. Ma'am, I welcome you to this program and thank you so much for taking time and being present here as a judge. Welcome, Madam Eugene, on behalf of Medlearn and the entire gathering here. I welcome Madam Maria Teresa Shanti. She is a nursing head for Star Care Specialty and Medical Center at Muscat. She comes with 24 years of nursing experience and 10 years in leadership roles. Ms. Maria currently heads 3 units at Star Care Muscat. She played a key role in commissioning hospitals and is now leading the setup of a new medical center, building a multinational team to meet international standards. I welcome Ms. Maria and I thank her on behalf of Medlan and the entire gathering. Welcome, ma'am.
Thank you.
I welcome Ms. Ramya J. Pujari. She's working as a nursing superintendent at Apollo Cradle and Children's Hospital. Mrs. Ramya has 11.5 years of experience, including her roles in the critical care nursing. She's also served as a nurse educator, and she's also been heading the infection control nurse and also served as the administrator in the Department of Nursing. She currently works as the nursing superintendent at Apollo Cradle. She's committed to enhancing nursing quality and patient safety through strong clinical and educational leadership that she brings. I welcome Madam Ramya on behalf of Medlan and the entire gathering. So I formally welcome all the judges and thank you so much. Next, we'll quickly be moving with the pick and speak competition. So just to give you a quick introduction, we will be randomly picking the topics for the competitors, and each of the competitor will be given 5 minutes time for revision. So we will be utilizing that time. So in the first 5 minutes, as soon as the topic is revealed, I request the competitors to utilize, and we will be calling you back at the end of 5 minutes. And as such, for the speech, you'll be given 4 minutes. At the end of 4 minutes, you get a reminder. And by the end of 5 minutes, you're supposed to conclude. So at 5 minutes and 30 seconds, you'll have to be finishing your session. So this is how is the flow of the program. The first participant would be Miss Elisa. Miss Elisa John Abreu. She's from Motherhood Hospital, Electronic City, Bangalore. So Elisa, you'll have the topic chosen for you with the help of technology. We're doing it through an AI tool so that you randomly get the topic selected. So Elisa, your time starts now. It's 3:13 and you get 5 minutes time. And the topic given to you is creating a culture of safety. Elisa, you can take your time for revision and we'll call you back after 5 minutes. So within the time, the first participant prepares herself for this pick and speak competition. Medlan is very happy to introduce to all the audience and the leaders from various hospitals gathered here, the entire team who are participating in the pick and speak. We're introducing you to a product called as Modular Skills Trainer. So Modular Skills Trainer, all of you must have heard about simulation. All of you must have heard about digital aspects of learning. So we bring to you what is called as Modular Skills Trainer. And this particular product is really going to be a boon when it comes to the nursing fraternity and also the clinical people, the paramedics, and all of them, those who are participating in the hospital, they're taking up various roles. I'm just sharing my screen. There's a lag, so I just request the audience to bear with me. So modular skills trainer brings with it 16 in one skills. A few to mention, like what you've already seen in the video: oxygen administration, nasogastric tube insertion and removal, tracheostomy care, wound care, ostomy care, oxygen administration, female urinary catheterization, rectal and vaginal suppository insertion, enema administration, and perineal care. So modular skills trainer works as a bridge between the student nurses. As you all know that we have a current challenge saying how much of the skills are the student nurses exposed to, how much of a chance do they get to kind of touch and heal the patients or treat them when they are in the student period. So that is very minimal. So modular skills trainer acts as a bridge when they are transitioning from the student period to staff period in a hospital. They have this wonderful experience through their skills lab, and this is highly portable. It weighs just around 1.5 to 2 kg, so it's highly portable, unlike a life-size mannequin. This can be taken to any workplace. Let's say it's a critical care area like the ICU or OT or a dialysis unit where the staffs cannot come out. This can be taken to their area and the staffs can practice the skills n number of times. The bigger point is you do not go and do a trial and error on the patient side. You reduce the errors on the patient side. You ensure safety and quality. That is what modular skills trainer is all about. And the other part of modular skills trainer, I will be talking about it before the second participant speaks. So I'm moving ahead with the first participant coming over to speak. I call Miss Elisa. Yes, Elisa, I hope you're ready. And your time starts now. You're given 5 minutes time. We'll give you a reminder at the fourth minute. All the best.
Thank you. Hello everyone, I'm Eliza John Ebro. I'm from Motherhood Hospital, Electronic City. So I'm speaking on the topic, a culture safety. Okay, a safety culture is an organizational culture that places a high level of importance on safety beliefs and values, and these are practiced in a healthcare setting. A culture of safety puts patients' well-being above all else. It begins with awareness, it continues with action, and thrives in accountability. I'll give you some directive points how the safety culture is performed. First, we can go with speak up culture, encouraging every team member to voice concerns without fear ensures that potential risks are caught early and the problems are made to solve in an initial stages. The second thing we can go for error reporting. The errors, mistakes happens from every individual. So reporting near misses and actual errors helps improve systems and prevent future harm to the people, to the patients, organization, and healthcare, and also to the healthcare setting. Second thing, the third point, we can also stick to the other ends of the protocol. The safety is only not about the patient safety, and it's also about the organizational safety. It's also the beliefs and values which are practiced. So adherence to protocols are which is a very important topic. It's a very important point in this. Following checklist, infection control practices, and verification steps help standardize safety across all the procedures. The checklist will help us to stick to the protocols and know whether if we are doing something wrong, or it will ensure the patient safety. All the things, whatever the procedures are done, whatever the things are carried out, including it is the inventories and whatever the things which is carried out, infection control practices and all the verification steps will help to will help in safety culture, will get in the safety process. Also, next point, we can go for the education and training. Education and training is very important. The regular drills which is happening in the healthcare settings, which will help will help the nurses to come overcome the safety practices, to know and learn more about the safety practices. Also the like simulations and also the updates, whatever the updates which keeps teams prepared for emergencies and awareness of evolving safety standards. This education and training programs will help the healthcare team members and also the nurses to know that how they have to standardize their knowledge, and also how to help the people regarding how they have to the care to the patient, how they have to give care to the patient, in keeping in mind the safety of them and of also the institution and the organization. Again, next point we can see for the leadership examples. It's very important when leaders model safe behaviors. It is the thing which it will help others when we become approachable. It will help others. Okay, like double checking medications or washing hands, the procedures, whatever procedures we are performing at the bedside or in the organization or in the hospital setting, we have to just cross check, which will be very safe and which will be safe and consistently. It sets a it sets a powerful standards. I would like to give an example, like if cross-checking of medication is not done, medication safety has to be performed to know whether we are giving when we are giving patient right medication to the right patient, right time and right dosage. So these are the safeties which we can stick to that, and the knowledge is very important. So concluding my topic, I can say safety isn't just a policy, it's a mindset. And when safety is everyone's responsibility, everyone gets benefits from it. Thank you.
Thank you so much, Elisa. That was a wonderful insight about creating a culture of safety. And who else can speak better than the nurses who always ensure safety, one to themselves and also to the society. Thank you so much. And we'll move on with the next participant. I would next like to call upon Ms. Tina Thomas from Rajgiri Hospital, Aluva, Ernakulam. She is our second participant. So Tina will be choosing a random topic for you with the help of the AI tool. Okay. So Tina, the topic that you have received for today is technology as a nursing ally. All the best to you. And your time starts now for the revision. It's 3:24. You'll be given 5 minutes time for the revision. So yes, I've introduced what is Modular Skills Trainer. Let's just understand a bit more as to how this particular product, as I said, a Modular Skills Trainer, the content and the assessment part is available for you on Medlearn. So when you talk about modular skills trainer, it's a 16-in-1 practice piece. This 16-in-1 practice piece has a very well structured theoretical program. So like how during the nursing period, you must have all learned starting from the introduction, the definition, the indications, contraindications, what are all the steps in a particular procedure along with rationale and a very beautiful pictorial representation. So all this was part of your content whenever you were student nurses and also staff nurses. You have learned a procedure in this manner. So this is exactly what MedLearn brings to you. All the 16 procedures content is available for you on the MedLearn platform. That is what I would be orienting you with. So this is how the program looks on our platform. These are the 16 skills, as I was mentioning to you, which the nurses could practice and move to the patient's side with confidence and with competency. So a small video, that is something that I've already oriented you to. This is how the parts appear when you actually separate them. So to start with, the structure of the program has a small pre-test or pre-quiz. You have 2 knowledge-based multiple choice questions, which let's say the learner has to take. So 2 knowledge-based questions and 2 scenario-based questions. Let's say we are first looking at intramuscular injection as a topic. So related to this content, you have 4 questions which you will have to take up as a pre-test. So I'm just randomly choosing this. And once the answers are submitted, you get a score. You can assess what's your pretest score and move on to the learning content. So when you see the learning content, as I said, there's a very clearly defined learning objective. You have the introduction, the anatomy and physiology, the points to remember whenever you're talking about preparation for intramuscular injection, uses of IM injection. So as I said, indications and contraindications, which is the ideal site for intramuscular injection, and also how do you identify the site appropriately, which is the gauge of needle that you use, and also a beautiful pictorial representation on complications. The next would be the procedures, equipments with, you can zoom in and see the pictures, especially the anatomy and physiology. It will help you to have a better understanding and also the visibility. So pre-procedure with rationale, similarly procedure and post-procedure, including the importance on documentation. So this is a video that is available for each procedure. This is a differentiator in the course that you can actually see a video and learn how to administer an intramuscular injection. So I will be orienting you to this video part in the next 5-minute slot that I get. So I call upon Ms. Tina. Tina, are you there?
Yes, ma'am.
All right. So your time starts now. It's 3:29 and you get 5 minutes. All the best.
Yeah, thank you, ma'am. So good afternoon to all. So first of all, I am thanking to give me such a wonderful topic to introduce in this section. So the technology as a nursing ally. First of all, we know that we all are living in the technological worlds and the nursing as a dynamic process. We need to know about the new technologies, arising technologies in this world. Then only we should have to provide a holistic care towards the patient and also to the betterment of the organization. So first and most, I wanted to introduce that most of the hospitals in India as well as apart from India, the EMR system has been laid down to introduce to having the documentation as well as for the patient care. The introduction of the EMR, about the 96% of the hospitals, apart from all the part of the world, has been introduced the system in which the documentation has become a very more reliable, and also at the confidentiality of the patient or patient data is also become more confidentiality has been become. And the other thing that I wanted to tell is that the telemedicine policies which has been introduced in most of the hospitals, in where the patients are very much cooperative in to have their medicines in the remote places. If the patient is coming from the remote places also, they are very much cope with these telemedicine policies, so that they will be able to get their medicines even in their finger points. The other thing that I should say, that just before the Mary ma'am has been introduced about the skill modular training, which is very much helpful for the nursing team as well as the upcoming nurses students to practice their skills in an online platform, so that they will be much more better when they come in practice with the real life strategy. And also we can say that apart from the EMR section, and also what all the technologies which has been laid down in the newer sections, these all made not only the nursing patient care, but the all entire health team to be performed in a very good accurate manner, whether the patient's care as in a holistic approach, and also to documentation, and also the reducing the errors while we are performing the documentation in the EMR system, as well as even the physician, the all entire medical team, whether it is a physician, pharmacist, nurses, all these teams has the ability to check whether the EMR in the EMR system and documentation with a proper manner, and also the care that we are providing to the patient with a timely manner too. So these all key things that has been introduced because of the new technologies arising in the nursing LA. The new technologies, when it comes to the practice, we should have to come across all these technologies within a limited time period. So the new upcoming nurses as well as those who are in this nursing system should have helping hands to one or the other way to practice these all things in the new upcoming way. So the teamwork all entire should be there for a teamwork, as well as in this new upcoming technologies we can study from the newer generation, upcoming generation, as well as the generations which is going on through. So these are the things that I wanted to tell, that is that the nursing technologies has been played a very big role, not only in the care system, but to have a change in the entire health team. So I conclude that's it. Thank you.
Tina, thank you so much. That was a very good insight, and for having shared your thoughts. We'll now move on to the third participant. Tina, thank you so much. I now call upon Mr. Siddhant Gupta from Indian Spinal Injury Center, Delhi. He's the third participant. Siddhant, very good afternoon and welcome. So we'll have the AI choose a topic for you. So your topic is time management at the bedside, right? Let us hear from you, what's your experience and how best a nurse can manage their time so that they go happy at the end of the shift, even on the most critical and testing day. All the best. So you will have 5 minutes time given for revision. Now it's 3:34 and we'll call you back. Yes, so I'm taking you back to Modular Skills Trainer. This is what the participants would experience. So as I said, this is a differentiator factor in your learning experience. So you've seen the entire content, the flow of the content, how well structured it is. This is a video-based guidance for the novice nurses.
Then allow it to dry completely.
With confidence.
Place a clean cotton swab between the third and fourth fingers of a non-dominant hand. Remove the needle cap by pulling it straight off the needle. Use your non-dominant hand to displace skin in a Z-track manner by pulling the skin down or to one side about 2 centimeters. Now hold the syringe between thumb and forefinger on the dominant hand like a dart. With skin held to one side, quickly insert the needle at a 90-degree angle. After the needle pierces the skin, continue pulling on the skin with a non-dominant hand. Once the needle has been inserted completely, grasp the lower end of the syringe barrel with the fingers of the non-dominant hand to stabilize it and move the dominant hand to the end of the plunger. Now slowly administer the medication. Once the medication is given, leave the needle in place for 10 seconds. Avoid moving the syringe as it can be painful for the patient. Remove the needle using a smooth, steady motion at the same angle at which it was inserted. Cover the injection site with a dry cotton ball, using gentle pressure. Remember not to massage the site. Apply Band-Aid as required. Discard the syringe in an appropriate sharps container. Remove gloves and perform hand hygiene. Assess the patient's response to the medication after the appropriate time frame. Document the medication, time, route, site, date of administration and effect of the medication, any adverse effects, outcomes, and any interventions applied.
So this is the video to help the learners better. We also have the references given from where this content was prepared. And finally, you have the post-test. So the same questions, whatever a person had taken in the pre-test, these are the same things that one would be receiving. So you take the post-test as well, and you get to see your scores. So this is how you have a pre-test. You have a learning content that is also helped with a very good video that is available for the learners to understand from, and a post-test. And this is finally what the assessors would do. Let's say I'm a mentor and I have two students, staff nurses under me, and they are in the orientation period. So once they are confident in practicing, their name will appear. Once they have completed their practice, they have completed the sessions like what I showed right now, pre-test, post-test, and completed all 16. Their names would appear in the assessor's chart here, or the access. So this is where the assessor will, let's say, choose my name. I'll just show you. And let's say I've completed learning about nasal swab. This is how my assessor will be able to assess me. So as I'm re-demonstrating, once I'm confident, practiced, finished the theory, my name goes to the assessor. They'll call me for a demonstration and check me on each of these steps that was there in the procedure. This comes as a checklist of assessment, basis which they'll be scoring the participants, and they will be completing their competency. This is what Modular Skills Trainer is all about. I'm sure many of you would be excited knowing about this product. So thank you for that. And Siddhant, you have 30 more seconds. You're ready? All right. So all the best, and you can start. Yeah. Unmute yourself, Siddhant. Unmute yourself.
You can unmute yourself.
You can unmute yourself.
Enabled.
It is enabled.
It is enabled.
It is enabled. So just try unmuting yourself. Okay. Can you try joining with your mobile? Okay. By then, I will just move on with the next participant. We'll call upon Kavya. Kavya, are you ready? Kavya from SiteCare. Kavya, are you ready?
Yes, hi.
Kavya, thank you so much. I think Siddhant had some issues, so maybe he can take the slot after you. And thank you for coming in early, right?
Thank you for having me.
Yes. So Kavya is the staff nurse. She works at SiteCare Hospital, Bangalore. And all the best to you, Kavya. We'll have the AI choose the topic for you.
Thank you.
Effective communication during handover, right? A very critical topic, right? Wishing you all the best. And you already had a thumbs up from the audience. So wishing you all the best. Kavya, your time starts now. So it's 3:41. You've got 5 minutes for revision. You can turn off your camera, yes. So now I request Miss Bhargavi.
It says only select participants can.
Siddhant, I can see your hand up. You've raised your hand. I think you can take the next slot after Kavya.
Hi, madam. You're not unable to hear you.
Bhargavi, can you hear me? Bhargavi, can you hear me?
No.
Can you hear me, Bhargavi?
No, I'm not able to hear you.
But you're responding to me, so
yeah, now I
can you turn
on?
All right. So if possible, if you can turn on your camera. Yes. So to all the dear audience, whoever are there in the pick and speak competition, Kavya is preparing. She's taking time for her revision. I'm really privileged and honored to welcome Miss Bhargavi. She's a nursing superintendent. I'll quickly give you an introduction about her. So Miss Bhargavi is the manager for nursing at NU Enterprises. She comes with 15 years of work experience. She is a specialized nurse in urodynamics nursing, and also she's a trainer in quality assurance. Bhargavi was honored the highest honor that is given to the nurses, that is the Florence Nightingale Award. So she received the 20th Florence Nightingale Award in the year 2022. She's the recipient of this most prestigious award. And this is for her outstanding contribution in the field of nursing, for her nursing excellence. So I welcome Ms. Bhargavi. So I've introduced Modular Skills Trainer to all of you. And Bhargavi, you're hearing it from a person who has already experienced what is called Modular Skills Trainer by herself and also her team. So I'm inviting her to share her experience about what does she feel about Modular Skills Trainer and how can this impact the young nurses when they come to the clinical services. Over to you, Bhargavi.
Okay, thank you, madam, for the opportunity. I'm very grateful to share my experience with the modular training planner. So, as we know that at present generation and situation is very difficult for everyone to train by feeling, touching, all these things. So when we are doing training like a classroom training, all these things, we come across with some deficiency. The deficiency was when we are teaching, they can grasp the things, but when you ask them to do it on a patient, they get very scared. So I was searching for something where I wanted to teach them by touch, feel, the things. So that time, right time, I got the product from Medland team. So when they discussed about this, I said I wanted to be the part of this and I wanted to know how it works. So then they invited us for the pilot studies. Around for the 2 months, we undergone the pilot study. Around 10 to 15 nurses have been selected for this, and 5 to 6 procedures has been allocated to for us, including me. I have undergone this training. So it is an excellent training modular for present nursing situations where there is a materials is already available where they have to read, and there is a videos are there where they can read themselves, and at last they can come and put it on the mannequin. That mannequin is really look like a you can feel like a patient. Okay, where they can do the at least a basic 16 procedures is the topmost procedures where they can do it on the patient. So I think it's from the IV cannulation like injections and NG tube feeding, removal, insertion, polycatheterization. These are all the common things where nurses not able to do this as a fresher. So when we done the pilot study for about a few 2 months, where our nursing staffs are extremely happy with the product. They said that we want that, so that, and our senior nurses and in charges says that please bring to that model so that we will teach the freshers, so that let them learn the things, they can put it on the patient side, and we can reduce the errors in the clinical side. So it's a very good product, and I'm very happy for this product and eagerly waiting for that when we are going to purchase that. It's an excellent, and we thanks to the Medland team for introducing such training materials for the continuous learning practices for the nurses. This product is really helpful for the freshers, those who join immediately, as we know that present college they won't teach much, where we when we take these products is definitely helpful for us. This is my input, madam. Thank you.
Thank you so much, Madam Bhargavi, for your inputs and also sharing your experience about Modular Skills Trainer, not only from your experience, your staff's experience as well. Thank you so much. And on behalf of Medlon, I thank you. So over to Ms. Kavya. Kavya, you're ready? Yes. Kavya, your time starts now. It's 3:48. All the best.
Good evening. I'm Kavya from SiteCare Hospitals. Thank you for the topic, effective communication during handover. Handover is one of the most critical part of our shift, and to be able to give a good handover, it's also very important to receive a good handover. So it's essential to ask the right questions during handover. And for example, patient has passed stools, patient has vomited. It is essential to ask what was the content of the stool, what was the content of the vomit, was it bloody, how did it look, did you inform the doctor? So to receive the right handover is very important, and to never miss any important information during the handover is also very essential. Maintain a record of everything and mention everything in a small less time consuming manner possible. And by handover, we don't just mean file handover or drug handover. It means every simple thing around the patient. Be it patient handover, how does the patient's skin look? Take a good look at the patient, see what can be wrong. Patient is tachypneic, patient is shivering, patient is sweating. Look at the vitals. During handover, it's very important to look at our patient and look at the patient's file. Is anything missing? Any procedures happened? Is, for example, a blood transfusion happened? Is the consent taken? Was the blood completely transfused? Was any reaction noted? Every small thing matters. And patient file handover, then comes patient surroundings handover. What we've intended for the patient, what we've gotten for the patient. Is anything not necessary around the patient? Can we return it back? Why is it not returned? So all these small things matter during handover. And even a very tiny thing like patient has been on home medications, or patient has a denture, patient has a prosthesis, handling the valuables, giving handover of the valuable also is very important, by doing which we can prevent a lot of unnecessary confusion, and legal issues for our hospital and for ourselves. So patient had a small, we can't mention something like gold or silver. We have to mention yellow or white. So small things like that is important for us during handover. And we also have to maintain a record of everything we get handed over in our systems as well. So during handover and to give a good handover after our shift is done, it is essential for us to jot down small things during our shift. A very small thing like patient had a little bit of water, 30 ml of water. We have to mention it somewhere we remember. We have monitoring intake output. We are monitoring vitals. So whenever possible, need not be at the right time, like sharp 4 o'clock, sharp 5 o'clock. Anywhere in between, it's important for us to mention whatever we can mention. And we can have a small to-do list, what has to be done, what needs to be given to the next staff, what has to be done in which time, which shift. So all these things we have made possible in a to-do list, in a small notepad. We always carry a pocket diary. It's essential to carry a pocket diary so that you can jot down these small things around the patient. We can't carry a big book and go around the patient. So carry a small pocket diary that we can jot down these important things in. And also handing over home medications. Patient is already a known case of diabetes, hypertension. It's very essential to ask questions. Okay, comorbidities. What medications is the patient on? Was he already taking any OHAs or insulin or any antihypertensives? It is very important to assess the patient even during handover. Handover doesn't just mean taking, like listening blindly to whatever our previous shift staff is saying, but also to assess the patient and look at the patient's condition and analyze what could be something he's on. If the doctor suggests a test, why do we have to do this test? Was there any reason, a particular reason we are doing this test for? What are the test results? For example, RFT was done. What are the results of the test? Is it critical? Do we have to, give the any correction for it? All of this is necessary. So to keep our, brains always alert is very important. To be vigilant during handover is very essential. And during handover, we have to monitor the way we hand over and any way we can improve our handover quality. And anything we can, we are always have to give space for improvement and try not to be intimidating during handovers, be approachable so that even if a small mistake happens during somebody's shift, they can openly tell you that I have missed doing this. I have not done this. Can you please do it in your shift? This kind of a rapport between you and your team members is very important. Having a rapport with your patient also is very important. So that patients these days are very, very alert and educated. They themselves tell, this is what I've been doing, this is what I need. An echo was prescribed for me, should I do this? So give them the space to communicate, have an open communication between patients and your colleagues. Be a good leader, and essential handover practices, improving handover practices and giving a lot of space for improvement is very essential. Critical, handover being the most critical part, we have to maintain at the best. Thank you.
Thank you so much, Ms. Kavya. So handover being a very critical aspect of nursing services, what you've highlighted from your end with, thought-provoking ideas as well. Thank you so much. Next, I would like to call upon Ms. Rasika. Judges, please note, she's not competing. She's one of the staff who's experienced modular skills trainer. She's practiced on modular skills trainer for almost close to 1.5 months. So she's here sharing her thoughts as a staff nurse. What does she feel about modular skills trainer? So judges, please note, she is not competing. Rasika?
One second. You have to pick up. Then give this opportunity.
Okay. So Rasika, just give us a moment. Okay. We will pick the topic for the next speaker in the line, that is Siddhant. Siddhant will pick the topic for you and then I will invite Rasika to speak. Can you answer to me, Siddhant?
Yes.
All right.
Am I audible? Sure.
Great. Let's see what's your luck this time.
Okay.
Promoting professional resilience. Resilience is the most, spoken about topic in the current, what to say, scenario or life as such. So you're here to talk about the same topic and to share your viewpoints. You have your 5 minutes of preparation. All the best. Rasika?
Yes, ma'am. I'm here.
Yes. Rasika, thank you so much for your dual role today. You're also a commentator, yes, and you're also here to share your feedback about what's your experience on using modular skills trainer from the staff nurses angle, right? So you're also a staff nurse very soon. I mean, ideally, you would also be a mentor soon. You'll be training your junior nurses, right? So what's your experience on modular skills trainer is what we want to understand. Miss Rasika is a staff nurse from NU Hospital. Over to you, Rasika.
Yeah, I'm actually thankful for that training material because I still do remember the first day when you just called me for the session and you asked me to just try this NG-tube insertion. And I was like, I know the theory part, ma'am, but I'm not sure about how to insert it. So that is what as a fresher nurses we go through. Maybe the theory part, yes, we are good in it. But when it comes to patient side, though we know the topic, we have the knowledge, but we are little afraid how to deal with it. What if something goes wrong? This is how we are scared. And this material, it just boosts up our energy. It gives us confidence to perform everything individually. So I actually that was the first time I inserted the NG tube. And if you let me do it now, without any mistake and without any doubt, I can do it on any patient. That is the confidence the modular training has given to me. And yeah, not only the NG tube insertion, like it can be IM injection also. Though it is a simple procedure, we think just giving an injection. But when you say it in a theoretical part, you have a brief thing starting from the parts of syringe. Have you located? Have you give the injection? That is how clearly the video represents the content in it, and everything is so prepared. Even with zero knowledge, if someone goes through that, they'll be able to do any procedure without any difficulties. They can do it with ease. That is what I would say about this module. Thank you.
Right. Thank you so much, Rasika. This definitely motivates MedLearn to take this up to many more healthcare professionals with confidence so that young nurses and also nurses, as we all know, nursing is something which is a continuous process. There is learning every day. So if you'll have to sharpen your skills after a while, right? This is also a source for you. You go back, you practice what is called the IV cannulation, you practice the other procedure. So once in a while, you take breaks, and then like you can as well practice. Let's say once in 3 months, you set up some practice sessions, and then the modular skills trainer will be very, very useful. So thank you so much, Rasika, for your inputs about the product. And definitely it helps MedLearn to go to the clients with confidence. Thank you so much. Right. So right. So as all of you are aware, like, we have had 3 participants who have completed their pick and speak speech. And all these topics were chosen around the International Nurses Days theme for this year. That is Our Nurses, Our Future, Caring for Nurses Strengthens Economies. So a nurse, if taken care, a ward if taken care, a department if taken care, a hospital if taken care, that directly contributes to what is called as patient satisfaction and quality service. It directly contributes to what is called as organizational excellence. Then you have the state, which has healthy citizens. You have the country, which has healthy citizens. You have the world with healthy people around. And when I talk about health, it is the holistic well-being of anybody. So nurses and healthcare professionals uh, should be thanked. We thank all of you for the service that you provide to mankind. May you be strengthened more and more to touch and influence many more lives. I will go over to Siddhant. You ready?
Yes, ma'am.
Okay. Yes, I have. Let's start. Okay, Siddhant, we can start off with you.
Sure.
Okay. And your time starts now. It's 4 p.m.
Okay. So very good afternoon to everyone, and thank you so much to Medlearn for giving me this opportunity. Today, I am representing Indian Spinal Injury Center in Delhi. My name is Siddhant Gupta, and I'm here talking about promoting professional resilience in nursing. So first, we have to understand what resilience in nursing means. The ability to endure and to face all the hardships that we like face in our daily activities in the hospital and with patients, with doctors. So that is resilience. So how can we do that? What will help us as nurses to get that resilience in our, because nursing is not only a physical thing that we do, is it take a lot of toll on our mental health too. So to promote professional resilience, what we can do first is normalizing support seeking, because as new staff nurses come to the circuit, and they are very hesitant to ask or seek for help. So if the leaders present there, the in charges, the team leaders, or the senior staffs there are there to reassure that they are not getting mentally exhausted, they will come to the leaders or to the seniors for their help. So we have to normalize the support seeking part. Provide access to growth opportunities. Like if someone in our circuit is good with infection control things, then we can push that person towards their goals and let them achieve the milestone that they can achieve that we think. Yes, obviously, not all the times that can be beneficial to the person or the organization, but yes, we have to take our chances. Well, team activities can be done. Monthly seminars, webinars can be done so that everyone can come into uh, the picture and tell their points where they are facing the problems, where they feel we should work more. Because nursing is not a single man task, it's a teamwork. And if teamwork is not there, then obviously a lot of difficulties will be there that we are facing already and we will face. On top of it, like recognizing their like when someone is in mental stress, we can recognize that by talking to them. But for that, we have to first lean in and have to ask ki what's the problem and why they are feeling the same way. So promoting professional resilience not only means that we just have to work about the things, it also means that mentally where we stand, we have to stabilize that. We have to maintain our work life and personal life balance. We have to uh, we have to work with our nurses for their well-being, for our organization well-being, because at the end of the day, if the nurse is mentally stable, if the nurse is able to work onto its full potential, it's the organization or the patients that are there are getting the benefit out of it. So professional resilience, promoting professional resilience can actually help us in a lot more ways that we can even think about. We might find something in our team that we never thought may exist. Thank you so much. And I'll conclude myself with that.
Yes, Siddhant, you have another 40 seconds. I mean, yes. So thank you so much for the highlights on the topic that was given to you, right? Thank you on behalf of Medlearn and wishing you all the best. Next, I would like to call upon Majidul. You're there? Yes. So Majidul, very good afternoon. Thank you so much. And Majidul is a staff nurse working in Site Care Hospital, and he joined Site Care as a new joiner, as a fresher, right? And he's here to share his experience about MedLearn and as well about the modular skills trainer. So we have him speak about his experience as a fresher and how did he transition from the practice sessions to the patient side. Majidul, you can go ahead.
Yes, unmute.
You have to unmute yourself. Yes, yes.
Is it audible, ma'am?
Yes, yes, audible. You can go ahead, Majidul.
Yes. Hi, good afternoon. This is Majidul Islam from Site Care Hospital. I pleased to get an opportunity to express my gratitude to towards MedLearn. Last year, November month, we had undergone various nursing procedures, that like IV cannula procedure, nasal swab collection, IME injection, and female catheterization, etc. through the mannequin. So
Majidul,
here I will be very happy to say that I am excellent practice.
Majidul, I'm sorry.
From
If you can
mannequin
just give us
to
a
real
minute.
human being as a patient.
Majidul, 1 minute. Just give us a minute. I'm really sorry.
Ma'am,
I
it is
think I
audible?
missed speaking out. Yes, it is audible. I want you to give us a minute as we have to pick a topic for Rasika. You please stay. Majidul, you please stay. Rasika, I'm sorry. We'll just pick a topic for you and continue with Majidul.
Hello.
Majidul, I can hear you. Rasika, I'm sorry. I think you can see your topic. Are you there, Rasika?
Yes, ma'am, I'm here. I could see it.
Yes, so nurse-led quality improvement. So what are the various quality improvement initiatives the nurses can take up is what is your topic, Rasika. You get 5 minutes from now. It is 4:07. No, the time is 4:07. Yes. Majidul, you can continue. You unmute yourself. You can unmute yourself. Majidul, unmute yourself. Are you able to unmute yourself? Kavya, if you can. Or Kavya, you can join through your phone as well. You can join that link through the phone, Kavya, and give it over to Majidul.
It's not happening.
Majidul, try unmuting जैसे आपने पहले किया first time. How you unmuted? Kavya, you can just correct this, or you can join through your mobile also and give it to Majidul if he can speak. The link is also there on your mobile. Okay, right, fine. So by the time Majidul gets ready, I just wanted to inform all the audience, like the topics that we have chosen for the Pick and Speak this time. So it is revolving around the theme of International Nurses Day for this year. So you must have heard about the audience speak up on various topics. Strengthening the nurses. What are all the various factors? Let us start from strengthening the nurses. I, as a nurse, have to strengthen myself. So how do I take care of myself? Strike a balance between work and life, take care of my health, mental and physical. So these are all the aspects one has to, look at or reflect upon when you talk about self-care. So at this moment, I'll also want to bring to your notice that there will be a much more insightful points for a minute or two from our judges later, saying how oneself, how a nurse can take care of themselves, preparing well to this demanding situation. Sometimes, you have patients who are different from who were there earlier. Now everybody who comes to the hospital comes with a full pack of knowledge, saying what is the issue they are going through, and how will they be able to get the treatment from the hospital, what are all the various treatment options, what would be the recovery period. So patient comes packed with the knowledge. So the nurses have to empower themselves with the right knowledge and skill so that they render or they care to the patients well. So this is how one has to prepare oneself to manage the challenging situation right now. So salutations to all the nurses who are doing it well, and take care of yourself is one point what we wanted to share. Next, also the importance of how the nursing department or the entire nursing team has to help each other, motivate each other, and take up various initiatives basis which the nurses can be supported to progress in their profession. Third comes the organizational responsibility as a whole, how an organization can contribute by giving nurses various opportunities to grow continuously in their profession, keep the knowledge of the nurses updated by giving them opportunities for learning, taking up many rewards and recognition sessions. So this is how we can empower and strengthen nurses. I think, yes, I think I have Majdool ready, right? Majdool, yes.
Yes, ma'am.
Okay. Majdool, we are running short of time, so hold the line. You just please wait for us. We have another 20 seconds left for the next participants to speak. So I will request you to speak after that participant. I'm really sorry. Okay, these are the technical issues we all come across, but thank you for being patient. Please stay with us. I will have the next participant of Pick and Speak to speak, and post that I'm eager, all of us are eager to hear from you. So I call upon Rasika. Majdool, you can have your camera turned off if you would want to. Or you can be there, no issues. Rasika, you're there?
Yes, ma'am. I'm over here.
Yes, Rasika, you can start, and your time is 4:13. The time is 4:13 now. You get 5 minutes.
Okay. Good evening, everyone. I'm here representing a new hospital. So the topic which I have got, that is nurse-led quality improvement. I think it is much more important topic. Like we should normalize speaking. We should bring forward. So I stand before you today to speak about something that is quietly transforming in healthcare form within. That is the nurse-led quality improvement. Okay, let me begin with a simple but important idea. Nurses don't just care for patient, they improve the system. We usually say that nurses are the heart of patient care. Yeah, that is true. So, because we are the first one to notice the complication and often the only constant present at the patient. Because we are at the front lines. They say where delay happens when medication error occurs and when patient get confused with the discharge summary. Nurse notices every single pattern, and When empowered, they can fix them. Across the world, nurse-led improvements are making a measurable difference, from reducing infection rates by improving hand hygiene practice and streamlining patient discharge procedures, like for improving the mental health support in communities. Now let's redefine leadership in healthcare. Leadership is not just about the titles what there. It is about the vision, action, as well as the result of the outcome. Okay. For simple words, when a nurse changes how medication is administered to reduce the errors, that is a leadership quality. And when nurse creates a checklist to prevent the infection. So yeah, we all have the checklist for all these bundles. We have Coty bundles, all these things that was made by nurses, because we are the one who observe, we are the one who see the sample cultures and update it to the doctor. So we know what happens. That is why the quality improvement, I'm sorry. Okay. When a nurse advocates, they become a better communication between the shifts. So this nurse improvement can be achieved through monitoring and providing them a technical support, as well as leadership managements, all these things. Let us empower all the nurses to lead. Let us give them the data, the voice, the tools that they needed to make the improvements. And we have this, we nurses monitor the CQIs, checklist, and I actually suggest, like, when there is a meeting, even nurses should be involved, because we see what is happening, and if they involve us, if they give us an opportunity, we can add what is happening and what should be corrected, everything. Yeah, thank you. I know I'm running out of time.
Kavya, you have another 1 minute and 30 seconds left from your slot. But if you're wishing to conclude, you could do so. All right. So that was, I'm sorry, that is Rasika. Rasika, you had another 1 minute, but you finished your topic. That's okay, right? Thank you. And yes, a bit of nervousness comes up at times, right? It's okay. So Majidul, over to you. Thank you for your patience. And yes, you can share your experience.
Yeah. Thank you, ma'am. Hi to everyone and good afternoon. Myself Majidul Islam from Sidecare Hospital, and I placed to get an opportunity to express my gratitude towards Medlan. Last year in November month, we have undergone various procedure skill training, like modular skill training, like IM injection, female catheterization, and swab collection and IV cannulation. And that here I'll be very happy to share my experience from the as a patient. I would like to share some benefit that mannequin we have undergone the procedure and we learned and we got some benefits. So it is the best practical place from where we are learning and where we are placing. Okay, and adequate theory. Medlan and modular we provided that best theory skill that we got and we got studied and we practiced well. Okay, and this is the time management and time saving. Okay, time management, if we're where we are placing that as a patient to mannequin, so we are finding the vein, we are searching the muscle easily and identify the correct site and correct thing. So we are placing and we are studying and following the procedure and getting the medication administration as mannequin. And here enough confidence. If through mannequin we have been practiced and we are undergone. So that is multiple time we can practice, and we have practiced that and we got learned, and we have now we are practicing as a patient. Okay, and gain knowledge from the knowledge from the practiced we got the adequate knowledge. That knowledge we are sharing with the patient, that helping out to do cannulation, other medication administered like IV injection and any other procedure. Okay, and this is the less pain and less fear and more successful. From that procedure, from the modular skill training, we whatever we have undergone through that, we learned, and it is less fear means we got that skilled, and as mannequin to as a patient, we're coming to the real field, actual scenario. So that time we know that actual procedure, actual theory, then we can go to patient side, we can follow the procedure, we can perform the procedure without making any error, and less pain to the patient, and more successful. That is done good things. I experienced these things, and overall is the good theoretical process. I learned in our team also learned these things, and in our scenario, in our department, especially in the emergency department, a patient is coming in serious condition. In that situation, in the critical situation, we need to follow that IV cannulation is the most important thing. So immediately finding that cannula, the cannula size, and that vein size, especially where we are putting, which vein we are putting, which site we are putting, and identifying the place, actual place, and how we are putting that thing, critical thinker, and that knowledge and that theoretical part placing to that actual scenario, that is helping out to follow the procedure, and it is very workful. Thank to Medlan to providing a modular skill training that helping to us a lot to procedure following to bedside. And thank you so much, ma'am. Thank you so much.
Majidul, thank you so much. Right. And also for audience and for everybody, Majidul was the first enthusiastic participant when the modular skills trainer was introduced. He was the first one to successfully complete all the procedures in first attempt, scoring a benchmark 75% that was set. So that is your enthusiasm, Majidul, and we know very well that you've utilized whatever is the opportunity given to you, and you will definitely do well in the clinicals. All the best from Medlearn. Thank you so much. So we have all the scores that has come up, right? I'm sure the participants, the speakers, the competitors, you're all excited. And also we are going to disclose the digital poster competitions results today. So I'm sure all of you are excited. The audience, those who are representing your hospitals, I'm sure you're excited as well. But before that, the experience, what the leaders in nursing bring. I have 3 judges, and I take this opportunity to request Madam Eugene. I would request Ramya first to just share her point on how a nurse has to take care of herself. I think we would just request you, maybe if you can take 2 minutes time to just share your viewpoint, Ms. Ramya, as to how an individual as a nurse has to take care of oneself so that they face what is called as the most challenging professional responsibilities. Over to you.
Thank you, ma'am, for the opportunity. Namaste. Very good evening to everyone. Hope all of you are doing fine. So taking care of ourselves is definitely, we being a nurses, we always take care of others. So our hand is always extended to the help to serve the community and the humankind. So when looking into that, this year theme is very well thought-provoking, one which was taken by the INC. Caring for the nurses strengthens the economy. Definitely, when we see even in India also, our nurse-patient ratio, we are in lack. As per that 1.9 per thousand population we are currently, but WHO says for 3 nurses required for 1,000 of population. So there are a number of cases where nurses get demotivated and moving or choosing the other profession. But there are a number of nurses still in the profession, getting retired from there. Recently, I've come 3 nurses who have served completely their lifetime in the nursing fraternity and the nursing field, and given a lot of contribution to the society. So here what it comes is the employee satisfaction. We being a nurses, we have to take care of ourselves. There will be nowadays organization focuses, the HR policies are well versed and developed into that extent that the employees are taken care well. So always there is a quote saying that happy employees is happy customers. So we have to take care of ourselves and our employees are taken care, nurses are taken care well. So how do we do that during the shift? So there will be maybe infrastructure facilities, food facilities, lounges may be there, etc. Organization may provide. So how do we take care of ourselves during the nursing shift? So it is very important. Mostly we go for 6 hours, 12 hours shift in a day, and taking care of the patients all over. So first and foremost is eating well. So whenever we come across, the breakfast is the most skipped meal among our nursing team. Whenever we check onto them, no breakfast is done. So but this breakfast is really important for our entire day to survive and keep those energies. So please have your breakfast on time. If no time, at least bring it. So there are hostelites who can quickly cook for yourself, include at least dry fruits and fruits in your meal or as a breakfast with the this, so that you start your day in a good way, that you are saving your energy, because definitely we are multitasking in the field. So and then water intake. So now we are young and energetic, we don't, but as we go on into the further age advances, so we will be having troubleshoots with the health issues. So to keep our health safe, if you are healthy, only we can take care of somebody else. So always carry a water bottles. So there is water provisions always in the department. Ensure that in that multitasking time, ensure that okay, this is a time for you to drink a glass of water at least. And your physical dynamics, how you are sitting, how you are standing, how you are bending. This really important. So at times we don't see all that thing and we just go forward to support the patient. So there we lose our body mechanics, basically land up in the occupational injuries, occupational hazards like lower backache or etc. So we have to ensure that body dynamics are taken care, so that we will live a long healthy life, taking care of others also. So breakfast, your water, your body dynamics is very important. And coming to very important, our occupation has a occupational hazard, very much focused into. So definitely every profession has its own risk and benefit. So when it comes to our profession, it is occupational safety. So please take care of yourself whenever you handle the blood and body fluid. It looks very simple that 1 second of negligence may ruin your entire life. So always think that there is family behind you supporting you. You have a family to go back to home and take care of them, and you are responsible for them. So keep that in mind and follow the safety practices in the workplace. So that ensures that your care is taken care. It is not only just learning, you have to practice it as well. So day-to-day basis, when you practice, it becomes a habit, and it goes on that you will have a safe working environment, and you're cared for yourself. And the other thing is mental peace, or the mental stability. So definitely when we are multitasking, we are stressed, no doubt. So please manage your time. So always give a priority to your work. You have 5 patients, 6 patients or more, whatever. Prioritize your work and complete those tasks on priority, what to be done within your shift. This is very important. With that, you will reduce your work stress and you will be fine while you give your handover, and you will be end of the day, you are satisfied with the work, and next day you come back with the same energy. So please take care of yourself while caring for others. That's it.
Thank you so much, Ramya ma'am, for the valuable inputs saying self-care comes first so that you're there for the fellow beings. Thank you so much. And now I request Ma'am Maria to share her inputs as to what becomes the nursing department's responsibility. And yes, I'm humbly reminding the judges, like, you've got 2 minutes. Ma'am Maria, if you can share your inputs about what becomes the nursing department's responsibility towards strengthening and taking care of nurses.
Good afternoon to all. I take this opportunity to wish all my nursing colleagues and my nurses a happy International Nurses Day. International Nurses Day is a day to recognize and appreciate the hard work, dedication, and compassion of nurses worldwide, actually. Thank you for all the sacrifices you have done to us and to the patients. Nursing is like an iceberg. Most of them doesn't know what nurses are exactly doing. Everybody think they know, they only give medication. No, they act like an advocate. They are counselors. They are team builders. They are policy makers, much more. So I take this opportunity to salute the real heroes. Happy Nurses Day. This was not my topic, but I just wanted to take this opportunity to wish everybody here. And my topic is how nursing department can strengthen the nurses. Okay, so the nursing department is a practiced nursing care that focused on the patient care and family-centered care, which is actually, it is of to the organizational values and respect, integrity, compassion, and excellence. So there are 3 core points which I would like to emphasize on this place. One is leaders' visibility. So how is a leader's visibility to be? Actually, leader's visibility is a key factor for a leader to connect with the team members and staff to maintain a meaningful connection. Leader's visibility means, I know everybody understand what is that. Say the leader should stay with the team, work with the team, understand their basics, what they are going through. That is why I mentioned as a leader's visibility. The second point which I would like to emphasize on is concise, clear two-way communication between the leader and the staff should be established for staff engagement. So one is about clear, concise communication between the team. That is from the leader to the team, team to the leader, team to the colleagues, team to the other department. So this is what we require. So communications has many ways. We have trainings, we have meetings, we have many other communications through WhatsApp messages. So these are the communications we have it. Other one is staff engagement. Staff engagement is very important for the present generation, actually. This staff engagement affects organizational performance, recruitment, retention, customers, services, satisfaction rates, and even profitability is improves in the organization. So in staff engagement, like we have many activities we can conduct so that they are engaged in the staff engagement. Third point is recognition. Recognition is an important tool for leaders to promote culture of excellence in an organization. It is an important tool for leaders to acknowledge someone highlighting excellence with rewards. So these are the 3 key points which I would like to emphasize how a nursing department can strengthen the nurses. So once again, I wish everybody all the best and happy Nurses Day. Thank you.
Thank you so much, Maria ma'am, for your inputs on how we as a team, strengthen the nursing professionals all together and be a strong workforce. And over to Madam Eugene, the key and the most important aspect of how an organization can strengthen their nurses. Ma'am, you have 2 minutes to share your points on how an organization can take care of their nurses. Thank you, ma'am.
A big shout out to everyone listening to me. And we will keep listening to many of the aspects of the International Nurses Day theme. For the year 2025, the International Nurses Day theme is Our Nurses, Our Future, Caring for Nurses Strengthens Economy. And my previous speakers have spoken already about how we as a nurse, we should take care, and how as a department, we should take care of the nurses. Now I will highlight few things on how the organization should take care of the nurses. The first thing which I want to highlight is the organization should invest in nurses' career development. What I meant is the career development is the organization or the management should lay down few rules to identify the potential candidates, who will be the potential candidates for the career development, provide them some incentives, for example, provide a sabbatical leave and encourage them to progress in their career. So that what happens is we are going to make them, or we are trying to retain them in our country itself. Also, the organization should identify there are certain ways to retain the nurses in India itself. For that, we may have to develop some kind of leadership pathways. As soon as a novice nurse enters into the Department of Nursing, you give them the highlights, or you give them an orientation about, okay, if you are going to be here in this place, how you can grow in your career in this particular hospital. So the career pathway has to be intimated to the nurses as soon as they join. So that's one way of, we try to retain them. I remember when I was doing my nursing, the organization where I joined, they have beautifully portrayed as a nurse, you enter, you work for 1 year, you work for 2 years, you work for 3 years, how you can grow in your career. So that was, one motivation for us to, okay, let me do this course and let me improve my knowledge, or let me improve my skills so that I can retain in my country, and, I will be climbing my ladders in the same organization. So the other way of looking at is nurses must be included in the decision-making tables with opportunities to grow into roles that influences the decisions and the policy shaping. So here also what I want to highlight is some of the organizations, especially the corporates, we have a monthly review meeting. The nurses are involved. Key identified people will be involved in the nursing, decision-making table. So that this will give an opportunity to exhibit or demonstrate the skills of a nurse leader. And in the future, that can be trickled down to the junior nurses. So the organization should identify, or they should, include the nurses also in the decision-making tables. And the other one, what I want to highlight is the work environment. This is very, very important as an organization. The culture has to be a positive working environment. That means there shouldn't be any blame culture. So that's why as a leader also, we should recommend to the organizations and to the other departments, saying that we don't want to follow a blame culture. We should identify, suppose if anything happens, we need to identify the root cause and encourage, correcting the process rather putting the blame on nurses. Then what happens, the nurses will have a lot of confidence. We help them to develop a confidence. Thereby we can provide a positive work environment. At the same time, also we should encourage our nurses, work-life balance. That's the one thing all of us are missing. We work, but we don't, find time for ourselves and, spend time with the family or go for the family parties and all that. We tend to forget. But moving forward, we as a leaders also to recommend our children how they can balance. Also, we should ensure that they have been given a proper leave whenever they are in need. That has to be ensured from the nurse leaders. The last one which I want to highlight is the health and the well-being of the nurses. As an organization, how do we ensure the health of our nurses? For example, when they are sick, the organization should provide them a sick leave. Okay, if it is a not simple sick leaves, When they are really sick, allow them to assume a sick role and give them the sick leaves. And some of the organization, I believe there is no sick leaves at all, only they have a EL and the CLs. But many of the organizations which I have worked and I have also experienced, the right to enjoy the sick leave. That is the one thing again we as nurse leaders to recommend to the organization, provide our nurses a sick leave and providing a good food for them. That is also to maintain the good health. If they are not healthy, how do they take care of a sick person? That's what we should ensure. As my first speaker said, encourage them, ask them when we see them, when we meet them in the ward, did you have anything in this morning? Or what have you had for your lunch? Also look at their menu. What is the type of food is being provided to the nurses? And we as a leaders should recommend to the organization, ensure that our girls gets a high protein diet, those who are in the hostel. Also, we should also look at people, those who are coming from outside. Can we give a subsidiary rate of food from our canteen or the cafeteria or whatever it is you call? So these are the certain things as a nurse leaders, I strongly feel that we should stand for our nurses and to recommend to the organization to provide all these facilities. Then I'm 100% sure we can retain our girls in this country. And we also will have a competent workforce, thereby we contribute to the community health. Thank you all for the patient listening. Thank you, Liz.
Thank you so much, Madam Eugene, for your inputs. Yes. So from step 1, growing as a staff nurse, growing into being an in-charge, supervisor, ANS, DNS, nursing superintendents, leader of an organization in terms of the nursing department. This is the journey that all our judges have come through. So that is how they are beautifully able to share their experiences. I thank all the judges once again. And I request now, this is the time to reveal, we are ready with the digital poster competitions results. So I will be requesting Madam Eugene to reveal the first and second place for the digital poster competition. And next, I will be requesting Madam Maria to reveal the first, the person who's taking the first place in Pick and Speak competition. So Ma'am Maria, we will be revealing the person who has won the first place in Pick and Speak. And I request Ma'am Ramya to reveal the second place of Pick and Speak. So over to Ma'am Eugene. You will be revealing the digital poster competitions winner. And I have my friend Shubha helping up with the display here. Yes. So digital poster competitions first place. I request Madam Eugene.
Wow, that's great. The first place go to Kim's Health Trivandrum. The participants are Jiva Robert, Affin, and Semino Francis. Congratulations, team.
So many congratulations to Kim's Hospital. You have secured the first place in the digital poster competition. And as ma'am read, we have 3 participants who have contributed, who have made this poster. Thank you so much, Team Kim's. And congratulations on behalf of all the judges here, participants, everybody, and Medlearn. Ma'am, I would also request you to reveal the second place.
Great. The second prize goes to Dr. Jiviraj Mehta Hospital, Ahmedabad. Participant is Kushi and Parole. Congratulations, dear team.
Thank you, ma'am. Congratulations to Dr. Jivraj Mehta Hospital on behalf of all of us. So this was the digital poster competitions results. Next, I would request Ma'am Maria to reveal the most awaited, the Pick and Speak competitions winners. She'll be revealing the first place. Over to my colleague Shubha to reveal the screen.
So the first prize goes to Miss Tina Thomas from Rajgiri Hospital, Aluva, Ernakulam. Congratulations, Tina.
Thank you, ma'am.
Thank you so much.
So any guesses, who's securing the second place? Any guess? Audience, I know it's difficult to respond, but yes. So there's a beautiful tie between 2 of the participants. This is the first time that we have a tie for the second place. And I would request Ma'am Ramya to reveal the winners of the second place. Ma'am Ramya? Okay, I think there's some issue from her side. On behalf of Madam Ramya, I take this opportunity to reveal the second place. We have a tie here. So the second place is taken by Kavya B from Sidecare Hospital, Bangalore, and also Miss Elisa John Abreu from Motherhood Hospital, Electronic City, Bangalore. So congratulations, all three of you, Tina, securing the first place, Kavya and Elisa taking the second place. Thank you so much, judges. And a special mention on behalf of Medlearn. I once again thank all our esteemed judges. Ramya, we lost you for a few seconds, but I took the chance of revealing it on behalf of you. So I would specially want to thank all my colleagues at Medlearn, especially Miss Shubhashri, if you can have your camera on. She heads the marketing and she supported entirely for this program, and all my other departmental heads, the hospital success team, sales team, and everybody who have contributed directly or indirectly towards the success of this program. Yes, for the small technical glitches and the small troubles that we had, I apologize, but I think we took it up, and thank you so much. So I have Miss Shubha on the screen. Thank you so much, Shubha, for all your support towards this program. And Eugene ma'am, Maria ma'am, and Ramya ma'am, thank you so much for your time and the valuable inputs you have given to the audience and all of us. So have a good evening, all of you. For the winners, yes, I would want to reveal. Thank you, ma'am. Thank you. For the winners, you would be receiving Amazon vouchers that will be mailed across to you from Medlearn. Thank you so much. And I congratulate all the organizations and the leaders, those whoever have nominated the participants, and also for the poster presentation. Thank you so much for your support. A very good evening to everybody, and we are closing the session. Thank you so much.
Thank you.
Thank you.
Thank you.
Thank you.